Hello and welcome. Today we're going to discuss pain control after bariatric surgery. This short presentation is geared towards understanding of different sources of pain and how to best treat it. This is intended for our patients as well as our nursing staff. I'm Dr. Houman. I'm Director of Bariatric Surgery at Providence Little Company of Mary Medical Center, Torrance in California, and I'm also a member of Association of South Bay Surgeons. In general, and just like any other surgical procedure, pain is expected, although to various degrees for different individuals after surgery. The way we try to best and most appropriately treat pain is by first figuring out what exactly is the source of the pain. So we've designed this algorithm for that purpose. So first question to ask by our nurses from the patients is the patient experiencing pain with drinking of their protein/water, or is the pain present without drinking? So we'll go into both sides of the screen, but let's begin with the left side. So next question is, if the pain is without intake of liquids, then the question is, where exactly is the pain? And there are different sites, obviously. Most obvious place would be the incisions. If the incisions are hurting, then appropriate type of pain medication can be given. Now, for our patients, I would like you to keep in mind that before you wake up from surgery, several different types of pain medication has been administered into your system. First and foremost, we numb your skin before we make the incisions. That's designed to prevent even start of the pain cascade at the skin level. So in general, the skin incisions should not hurt too badly, although again, it is certainly possible. In addition to numbing the skin, usually 2, if not 3 different classes of different types of pain medication are given to you all into your IVs and into your bloodstream before you wake up. So a good amount of pain medication and different classes of them have been given. I'm only mentioning that so that you all realize that there are several steps I've taken, and that's precisely the reason that many patients wake up from surgery and are actually quite comfortable. Nevertheless, if there is pain, we would like to treat it appropriately. So incisional pain can certainly be present, and depending on how severe it is, our nursing staff can treat it with non-narcotic medication or narcotic medication as well. As a fundamental rule, we try to minimize giving narcotic medication if we can. They're available if needed, but narcotics can make someone sleepy. They can cause nausea, which is we try to best avoid it, especially with bariatric surgery patients. And also they slow down the intestinal function to some degree. So if the pain is not too severe, we rather treat it with non-narcotic medications. And usually we have 1 or 2 different classes available for each individual. So that's the short explanation for incisional pain. Second column and here in the middle is that when patient reports that their entire abdomen sort of hurts, and not necessarily the incisions, but the abdomen feels bloated, they feel uncomfortable, and they also very often report that they feel like they have trapped gas all over their abdomen. And That can also be experienced after just about any surgery. This is mainly because the anesthetic and the medications that patients get under anesthesia can cause the intestines to sort of fall asleep, what we call ileus. This is so then the gas that normally people pass from the bottom, they cannot pass, mainly because the intestines are a little sleepy and they're not squeezing downstream properly. That will pass with time, and the gas we're talking about is different than the gas that we put inside the abdomen to perform these surgeries. These are two separate things, and we'll talk about that in a second. Nevertheless, if the report is the entire abdomen hurting, bloating, gas not passing, etc., then we try to have the individuals walk. Sometimes we can give him a suppository in a rectal route, and that can help resolve this issue as well. Next type of pain we're going to talk about is when an individual has a pain in their chest, usually lower chest, and specifically when they take deep breaths. That again has to do with the gas that we put inside of the abdomen to blow the abdomen larger a little bit so we can see and perform the procedures. Again, walking can help that, and that also will pass. Now, chest pain usually worries us a little bit because chest pain can also be from a cardiac source or pulmonary source. So anytime there's chest pain, we would like our patients to report that to their nurses, and our nurses can sort of clarify. Whenever there's any doubt, we will obtain an EKG, a chest X-ray, different labs to make sure that the source of pain is not from the heart or the lungs. Last set of explanation for pain that comes without drinking is if the individual, the patients, report shoulder and or neck pain. This classically is from the gas that we put inside the abdomen. CO2 is the gas that we use often. Before we finish the procedure, we suction the gas out, but nevertheless, while the procedure was happening, the gas probably irritated the diaphragm muscle, or some gas gets trapped, left behind, and continues to irritate the diaphragm muscle, which causes neck pain and shoulder pain. Now, this pain will also resolve, usually 24 to 48 hours. If somebody has it, it should dramatically improve. But nevertheless, if it's severe enough, we treat it. Now, the first thing to do again is to try walking to sort of help the gas dissipate. And if pain is still remaining after that, and if it's substantial enough, we can certainly treat it. Non-narcotic pain medication, and specifically what we call the class of drugs we call NSAIDs, are very effective for this class of pain, this type of pain. So that's a short explanation about when there's pain that does not involve oral intake. Now, I mentioned that oral intake can cause pain. The reason for that after bariatric surgery is that bariatric surgery involves, without exception, alteration of the shape of the stomach. And that change in shape of stomach, that cut edge, brings about different sort of pressure sometimes inside the stomach, and of course different shape of the stomach. And because the individual just had surgery, also this new stomach can be swollen, and as a result, passage of fluids or food initially can cause pain. Not too common, but it definitely can happen. It will certainly pass, and great majority of people feel just fine after a few days. Now, the way to further investigate and how to best and most appropriately treat this category of pain is to find out if the pain comes when the individual drinks protein drink, or if they get the pain with water, or both. So let's begin if pain comes with intake of protein, which is the most common. Protein has a little bit thicker texture, and often can cause pain for some people. So what we recommend, and it's very easy to do, is to dilute the protein drink with some water. You can dilute as much as you want. The water that you are going to drink anyways, you can just use to dilute your protein drink. Usually, if it's diluted, half water, half protein, or 2/3 water, 1/3 protein, that usually works. Also, you may want to try taking smaller sips of the protein drink. Bigger sips sometimes bother people in the early stages. Again, if that does not work, if diluting it or taking smaller sip does not work, then and as long as they're okay with water, we can give a medication called Decadron that kind of calms the stomach and the intestines and may help resolve this pain. But the important thing is that there's good communication and understanding of what exactly is causing the pain. Now, like I said, most commonly the protein drinks cause pain with drinking, but sometimes some individuals say that the protein drink goes down fine and water is the thing that hurts. So same idea. You put the water in the protein and hopefully that will help resolve the pain. Now, sometimes our nurses can also offer to ice the protein or ice the water or warm it. Some people like their fluids warmer, sometimes they like it colder. Whatever works, then it's perfectly okay to try. Now, if that does not work, then medication can be given. Again, Decadron is always available to use. If there's quite a bit of pain and it's with everything, meaning both water and protein hurt to a substantial degree, and Decadron has been given and it's still not resolving the pain, then the only thing left to do is to wait. We give the stomach some rest and nothing to drink for a few hours, and then we have them start again. So this is how we think about pain control after bariatric surgery. I hope this is helpful. I would like to reassure our patients that our nurses are very, very well trained, and they can always contact us anytime, 24/7, and you will be very well taken care of. Thanks for listening. We'll see you soon.